number of coronavirus cases in Los Angeles County comes to 1,194,242. The confirmed number of deaths reaches 21,554. Here in Torrance, the total number of confirmed cases is 6,728, with total confirmed deaths at 175. We anticipate those numbers to increase as the county updates its last 24-hour operating period. Welcome to COVID-19 Today. I'm Rhiannon Trutanich. It's 4 p.m. on Wednesday, March 3rd. Los Angeles County continues to inch closer to moving out of the most restrictive tier as COVID-19 cases continue to steadily decline. For the first time in months, the county is close to meeting the requirements to get out of the purple tier in the state's coronavirus reopening system. If cases continue to drop at this rate, the county may be able to move into the red tier by the end of the month. The county's daily case rate is currently at 7.2 per 100,000 residents. It must drop down to 7 per 100,000 and remain that way for 2 consecutive weeks before the county can be eligible. This means indoor dining at a limited capacity could return, along with movie theaters and the return of middle and high school students back to campus for in-person learning. Now, even if the county meets the state's requirements, the county must first authorize the rollback of current restrictions. Throughout the past year, the county only came close to moving out of the purple tier in September when the county's case rate fell low enough to qualify for the red tier, but that only lasted for 1 of the 2 required weeks. Some good news for 7 counties in California, as they're now eligible to move from the purple, most restrictive tier to the next red tier, allowing for more of the economy to reopen. Those counties include Santa Clara, San Francisco, San Luis Obispo, El Dorado, Napa, Lawson, and Modoc. Collectively, they represent about 13% of the state's population. San Francisco Mayor London Breed announced indoor dining, movie theaters, gyms, museums, zoos, and aquariums would be allowed to reopen at 25% capacity beginning today. In California's reopening roadmap, the 4 colored tiers are based on 3 criteria. Their average coronavirus case rates, which are adjusted based on the number of tests performed, testing positivity rate, and a health equity metric intended to ensure the positivity rate in poor communities does not significantly lag behind the overall county. One pharmacy is expanding their ability to vaccinate more Americans as CVS Health announced 40 more select locations will begin offering them throughout California. Nearly 20 of those locations can be found in Los Angeles County. The company said about 49,000 doses of the Pfizer COVID-19 vaccine are being made available to distribute at these locations in California through the federal retail pharmacy program. CVS has the capacity to administer 20 to 25 million shots per month. Vaccines are offered by appointment only through CVS.com or through the CVS app. President Joe Biden says all Americans should have access to a COVID-19 vaccine by the end of May, moving up his original timeline by nearly 2 months. President Biden's projection comes as both Pfizer and Moderna ramp up production on their 2-dose vaccines, and just days after the U.S. Food and Drug Administration approved emergency use authorization to Johnson & Johnson for their single-shot vaccine, which is expected to bring an additional 20 million doses into the market by the end of the month. The federal government will also increase supply of the state's Moderna and Pfizer vaccines to 15.2 million doses per week, up from 14.5 million from the week prior. States across the country are also expected to get 2.8 million doses of the Johnson & Johnson shot this week. In a press conference on Tuesday, President Biden urged Americans to continue to wear masks, wash hands, and get the vaccine when it's your turn. The University of California, Irvine released a new study recently that found alarming results during the pandemic. UCI researchers led a study that showed that gunshot and knife wounds increased during the past year in Southern California, while injuries from traffic crashes were down, possibly due to less cars on the road. Published online in the Journal of Trauma and Acute Care Surgery, researchers reviewed 20,450 trauma patients who were treated at 11 hospitals across 7 counties. This study is the first large-scale analysis of the stay-at-home orders on trauma treatment. The study found a 21% increase in rates of knife-related trauma and a 24% increase in rates of gunshot wounds during the period after California's stay-at-home order was issued a year ago. While this study captures the most violent incidents that were seen at major trauma centers across the state, it may not reflect how the pandemic has impacted other traumatic incidents like domestic violence or attempted suicides. A new report revealed that California leads the country in methamphetamine conversion labs, and Los Angeles remains as one of the major shipping points for Mexican drug cartels. The alarming findings is based on the 2020 National Drug Threat Assessment released by the U.S. Drug Enforcement Administration. The annual report, which outlines threats posed by domestic and international drug trafficking and the abuse of illicit drugs, also found that in 2019, California had seized more fentanyl than any other state and had the second highest amount of cocaine found. According to the report, opioid threat also still remains at epidemic levels. The U.S. Centers for Disease Control and Prevention found that more than 83,000 people died from drug-related overdoses in the 12-month period ending in July of 2020, an increase by 13,000 from 2019. The DEA acting administrator, D. Christopher Evans, says this year's report shows the harsh reality of the drug threats that communities still face across the United States. Job seekers will have a chance to work at one of Southern California's popular theme parks. Knott's Berry Farm announced plans to hire up to 1,700 people as the theme park plans for its reopening sometime later this year. Cedar Fair, which operates 17 theme parks and 11 hotels, including Knott's, will host an online job fair next week. Anyone interested can sign up on March 13th. Positions include amusement park operators, jobs in food services, merchandise sales, lifeguards, cleaning, park services, and much more. The online recruitment day will include information on available jobs and individual interviews with recruitment teams. The park also offers virtual orientations to help new employees prepare to work. Knott's Berry Farm and Knott's Soak City has remained closed since the pandemic started. The hotel, along with California Marketplace and Knott's Chicken Dinner Restaurant, have reopened for outdoor dining. Orange County is hoping to move into the state's less restrictive red tier as early as this week, which would allow for more businesses and organizations to reopen. Well, not too far away from Knott's, another theme park is gearing up for a unique event. Tickets are now available to purchase a Touch of Disney, a limited capacity event at Disney California Adventure Park. It kicks off on March 18th, and you can pay to take part in world-famous food and beverage offerings from around the resort, along with fan favorites including churros, roasted turkey legs, and Dole Whip. Then beginning on March 11th, guests can also make reservations at the exclusive Lamplight Lounge and Carthay Circle Lounge. There will be scheduled appearances by Disney characters such as Mickey and Minnie, and you'll be able to pose for pictures at unique pop-up photo locations. This announcement also means about 1,000 Disney employees or cast members will be able to return to work. The experience starts at $75, which includes admission, parking, and unlimited PhotoPass downloads, along with a $25 dining card. The event will be offered Thursdays through Mondays from noon until 8 p.m. The Torrance City Council members met online last night to conduct city business. On the agenda, items included a proclamation declaring March 7th through the 14th as California Arbor Week in the city of Torrance. The city manager also gave updates on the city's COVID-19 response and recovery efforts, which includes expanding and restoring as many recreational opportunities in the city that are allowed by the county's most updated public health guidelines. This includes restoring basketball hoops and posting signage discouraging competitive gameplay, but rather games among members of a single household. The city will also expand youth and adult sports with the addition of low-contact sports and allowing field rentals by youth sports organizations. Staff also shared a debrief on the 2020 Seaside Rancho's Holiday Lights display, which included feedback from the residents of that community, along with the breakdown of police resources used to help with traffic and safety of the popular destination during the holidays. Staff will come back in June to discuss the direction of the upcoming 2021 season. The city's community development director and the city's transit director also shared in detail an update on the Metro C Line extension program. These and several other administrative matters were discussed in last night's meeting. You can hear the full discussion by watching the replay of the meeting on our channel throughout the week, as well as online and on YouTube. Heading into March, we take a look at the toll the coronavirus pandemic has had on our health and wellness, as doctors say don't delay or put off scheduling that much-needed appointment. In this week's Wellness Wednesday segment, Christine Lee visits Providence Little Company of Mary in Torrance to learn more.
As COVID numbers go down and vaccine productions ramp up, we're checking in with one of our local hospitals to see how they're doing. Joining me right now is Dr. George Vernis with the Providence Little Company of Mary Medical Center here in Torrance. Thanks so much for joining me today.
Thanks for having me.
So how has the past year been? Can you walk me through your personal journey?
Sure. So it's been a kind of a roller coaster over the last year. I think the pandemic started about a year ago now. We were all very fearful coming to work back then. We didn't know what was going to happen with the virus, if we were going to get exposed, if we had enough PPE, if our PPE would work. So it was very fearful back then. Luckily, our spring kind of surge was not as bad as we expected. One kind of consequence of all the stay-at-home orders is actually our volume of ER patients back in April and May dropped by 70%. So we really had a precipitous drop in the patients just coming for routine care, and I think really in fear of getting COVID or catching COVID or being around COVID patients. So that was the kind of the initial first surge kind of experience. We got through that. Once the first surge was over, the summer kind of turned back to normal. COVID was always there, but patients started coming back to the emergency room. But one thing we did notice is during that April-May time, people delayed real serious symptoms. They had chest pain, they had heart attacks and strokes, and never presented to the hospital and had worse outcomes. So that was a concern early on. After getting through the fall, and then this latest surge was much, much worse. Kind of in the spring, our max COVID patients in the hospital was 80. We were down to the 10s and 20s in this fall, and our peak in January was 180 patients in the hospital at one time. So this last surge was much, much worse in the spring, and it was very challenging to all of us. One nice thing is that most of the caregivers had already started to get their vaccine, so that fear of catching COVID from your patients was much less. Yeah. So luckily that second surge is over, and we're in a much better place now. So it's been a tough year.
At the peak, how many hours do you think you were logging per shift?
So in the ER we have dedicated shift times, and so we come and go on those times. We didn't really need to have extra hours. In fact, again, like in the spring, our overall patient volume in the ER has been less than traditional. So we have plenty of physician coverage for the patients that we had.
Well, you and those at the hospital, I mean, you're experiencing such a unique journey together. How were you able to support each other during that time?
There's a collective need. I think we're all comrades. We're all here to work together for the community and our patients. And so the physicians and the nurses and nurse practitioners, we all work together as a team to help the patients in the ER and the hospital. I mean, we work closely with our hospitalist doctors and ICU doctors, and we're here to treat our patients. I would say, our administration has been very supportive of us. And one thing I noticed at our hospital compared to ones I've seen in the news is that even when we are at our peak, our ICU was full, Many hospitals then turned their ERs into extra ICUs and really limited access to the community. Here at Little Company, our administration did an amazing job of expanding our ICUs, having those 180 patients in different parts of the hospital. It allowed our ER to function really well even during the worst times of the last surge.
That's great to hear. And as COVID numbers start to go down a lot now, are you thinking about unwinding?
I would say yes. We're still, holding our breath. I think the most unwinding I've done so far is just to go about to the restaurants that I like to go to that are now open. We can at least sit outside. So I think that's about it for me.
Mm-hmm. And for me, as a non-COVID patient, the thought of going back to a hospital type setting honestly worried me. I'm thinking that there are people with COVID that could have walked down the exact same hallways. Now, is this a common fear a lot of patients have? And what can you say about the safety of the hospitals now?
I would say it's a very common fear. I mean, as I talked about the numbers in the spring, and even now we're still down from our ER patients, that it is a fear. It's a very rational fear, but what we've learned over the last year is to do the best practices of infection control. We test every patient that comes in the hospital for COVID. They go on dedicated units. So there really is little to no chance of being exposed to COVID coming to the hospital or a medical setting at this time.
Yeah. And why is it so important for people to stay on top of their health right now, be proactive and not delay care or screenings?
Like I mentioned in the spring, we had a lot of bad outcomes. People delaying care, not coming to the hospital for their chest pain or stroke-like symptoms, and then they had worse outcomes, or delaying their abdominal pain, and now their pen has now burst and they're having a worse outcome. So all those reasons, don't wait. If you have any symptoms that you're concerned, our emergency department's open. We have plenty of capability to see you. Infection controls are all in place. All our caregivers pretty much have been vaccinated. So there's no fear. You should take care of your health, and we are here to take care of you.
Thank you so much, Dr. Vernes, for sharing your thoughts with us today.
Thanks for having me.
And as he said, hospitals are doing all they can to keep you as safe as possible. So don't delay and make that appointment today.
Thanks so much, Christine. Great information. Well, before we go, at the end of each program, we like to share stories from our community, feel-good pictures, images, and videos that remind us of how resilient our community is and how Torrance truly cares. The Torrance Rose Float Association is teaming up with Black Bear Diner today to help raise funds for the organization. Whether you order for carry-out, delivery, or to dine outdoors at their restaurant located on Hawthorne Boulevard near Pacific Coast Highway, 10% of your check will go back to the organization. Go to the Torrance Rose Float Association's website at torrancerosefloat.org, go to events, and print out the flyer under 2021 events. Or if you pull it up on your phone, be sure to present the 9-digit number under the barcode to ensure that the TRFA receives the 10% credit. What a great way to enjoy a great meal while supporting a great organization that continues to contribute so much to the Torrance community. Now, if you have a great story, upcoming event, a photo, or video you'd like to share, email us at covid19today@torranceca.gov. We'd love to hear from you. Well, that's our update for COVID-19 today. Be sure to tune in tomorrow as Ben McCain brings you the latest. Be safe, stay healthy, and thanks for tuning in. We'll see you next time.